In this video, I am going to discuss about the cranial nerve. So we have 12 cranial nerves. The number 1 is olfactory, then number 2 is optic, then number 3 is oculomotor, number 4 is trochlear, number 5 is trigeminal, number 6 is abducens, number 7 is facial, then number 8 is vestibulocochlear, then number 9 is glossopharyngeal, number 10 is vagus, number 11 is accessories, then number 12 is hypoglossal. So now come to the cranial nerves function and type and assessment. The first cranial nerves, it is olfactory nerve. This olfactory nerves, this type of this olfactory is sensory nerve, and the function is smell and abnormal signs, that is inability to detect smell. And the assessment, this assessment is tested by use of non-irritating volatile oil or liquid. If the patient he recognizes that things through the smell, then the nerve is intact. Then come to the number 2 cranial nerve, that is optic, and it is a sensory nerve, and the function is vision. An abnormal sign, that is loss of visual acuity, loss of blindness, defect visual field. An assessment tested for visual acuity by Snellen chart, and the test tested for visual field by perimetry test. These are the test assessment for optic nerve. Then number 3 is oculomotor nerve, and this is the motor types of nerve, and the function is pupil constriction, accommodation of lens, then movement of eyeball and eyelid. This is the function. And abnormal signs, papillary dilatation, loss of accommodation reflex, diplopia, ptosis, squint. Then assessment is test pupillary light reflex, test for accommodation reflex, then test eyeball and eyelid movement. Then number 4 is trochlear, and trochlear, it is a type of motor nerve, and the function is movement of eyeball in upper direction. Then abnormal sign, diplopia, adductor paralysis. These are abnormal signs. And assessment assess the eye movement. We ask the subject to move your eye upward direction. If the subject can able to do this movement, then this nerve is intact. Then come to the next cranial nerve, that is the number 5 cranial nerve, trigeminal. The trigeminal, it is a mixed type of nerve, and the function is mastication, somatosensation, and face, cornea and anterior tongue. And abnormal signs, these are weakness and wasting of mastication muscles, then loss of sensation in eye, face, sinuses and teeth, then trigeminal neuralgia. And the assessment is ask the patient to clench jaws, then hold the jaw against the resistance for test sensation, forehead, cheek, chin, test corneal reflex. These are the test sensation. This test sensation we can done with the help of cotton swab. Then number 6 is abducens. This number 6 is abducens. The name of that 6 is function is movement of eyeball in outward direction, and it is a motor type of nerve. And the abnormal signs, diplopia with gas palsy. This is the abnormal sign. And assessment is test of eye movement. We ask the patient to move your eye in outward direction. If the patient can able to do this movement, then the nerve is intact. Then come to the 7 cranial nerve, and that is mixed type of nerve. In 7 cranial nerve, facial nerve. Facial nerve have sensory and motor both types. So the function of this 7 cranial nerve is facial movement, then salivary secretion, submandibular gland, then sublingual taste for anterior 2/3 of tongue, somatosensation. Then the abnormal sign is Bell's palsy, loss of taste, inability to close eyes. Then assessment is ask the patient to raise your eyebrows, then the show teeth, smile, close your eyes, tightly puff cheeks. These are the motor taste for this facial muscles. Then for taste, the taste for taste, that is the sweet, salty, sour and bitter. We give this type of taste to the patient. Then come to the 8th cranial nerve, that is vestibulocochlear nerve, and it is a sensory type of nerve, and the function is hearing and equilibrium. And the abnormal sign is deafness, tinnitus, vertigo, nystagmus. And the assessment for the hearing, we assess through Rennie test and Weber test, and Rennie is a sensory neural test, and the Weber is a bony conduction test. Then for equilibrium, assess the balance, nystagmus and eye-head coordination.